Paliperidone. Generic tablets are available, but it's also sold under the brand name Invega. This medication is an antipsychotic. Common dosage forms of paliperidone include extended-release tablets and an injection, also known as Sustenna. The extended-release tablets come in a 1.5 mg, 3 mg, 6 mg, and a 9 mg strength. The injection comes as pre-filled syringes containing 39 mg, 78 mg, 117 mg, 156 mg, or 234 mg of paliperidone palmitate. This medication is indicated for the treatment of schizophrenia and schizoaffective disorder, either as monotherapy or as an adjunct to mood stabilizers and/or antidepressants. The recommended dose is 6 mg orally once daily in the morning. Some patients may require a higher dose, and in other patients, a lower dose may be effective. The maximum recommended daily dose is 12 mg. The intramuscular injection can also be used for the acute and maintenance treatment of schizophrenia in adults. The recommended titration schedule for an intramuscular treatment is a dose of 234 mg on day 1 and 156 mg 1 week later. The recommended maintenance dose is 117 mg given once monthly. The preferred injection site is the deltoid muscle. It's important to monitor fasting blood glucose, lipid panel, weight, blood pressure, and complete blood count when taking this medication. Paliperidone is a major active metabolite of risperidone. It is thought to act by direct antagonism of dopamine at the D2 receptor and serotonin at the 5-HT2 receptor in the central nervous system. It also produces antagonism of alpha-1, alpha-2, and H1 histaminergic receptors. Peak plasma levels after an oral dose are reached in 24 hours with the terminal half-life of 23 hours. Steady-state plasma levels are reached in 4 to 5 days after oral dosing. Food increases oral bioavailability by approximately 55%. Protein binding is approximately 74%. About 59% of an oral dose is excreted unchanged in the urine, and 32% as metabolites. Metabolism occurs via cytochrome P450, 2D6, and cytochrome P450, 3A4. Paliperidone palmitate in the Sustenna injection form has a low water solubility and dissolves very slowly after injection into the muscle tissue. Peak plasma levels after an intramuscular dose are reached in about 13 days. Drug interactions for paliperidone are as follows. Paliperidone may decrease the effects of levodopa. Carbamazepine may increase the clearance of paliperidone. Additive sedative effects are seen when given with other CNS depressants. Use caution with other drugs which prolong the QT interval. Paliperidone is contraindicated in patients with dementia-related psychosis. Antipsychotic drugs have produced a potentially fatal symptom complex called the neuroleptic malignant syndrome, or NMS. Signs of NMS include muscle rigidity, hyperpyrexia, and autonomic instability. If NMS occurs, stop therapy and institute appropriate supportive treatment. Antipsychotic drugs have produced irreversible tardive dyskinesia. Paliperidone may lengthen the QT interval and produce orthostatic hypotension in some patients. Use with caution in patients with bradycardia, electrolyte imbalance, or cardiovascular disease. Used with caution in patients with a history of seizures. Atypical antipsychotics have been associated with severe hyperglycemic reactions. These reactions have included ketoacidosis, coma, and death. Patients with established diagnosis of diabetes mellitus who are started on paliperidone should be monitored regularly for worsening of glucose control. Paliperidone may cause hyperprolactinemia or priapism. Do not dispense large quantities of this drug to suicidal patients. Rare cases of leukopenia, neutropenia, and agranulocytosis have been reported in patients taking antipsychotic agents. Paliperidone is pregnancy category C. The most common adverse effects after oral therapy of paliperidone are tachycardia, nausea, QT prolongation, akathisia, dizziness, headache, somnolence, tremor, and anxiety. The intramuscular dosing may also cause injection site reactions. When consulting a patient about using paliperidone, you should include the following points. This medication may cause fainting during initial doses. Use caution when getting up from sitting or lying position. This medication may impair judgment. Use caution when operating machinery, including automobiles. Avoid alcohol during therapy. If GI upset occurs after taking the oral tablets, you may take paliperidone with food or milk. Swallow paliperidone tablets whole. Do not split, crush, or chew the tablets. avoid overexposure to sunlight and extreme temperatures during therapy. Do not take any over-the-counter medications without first checking with a physician or pharmacist. If you miss a dose, take it as soon as possible, but if it's closer to the time of your next dose than the dose you missed, skip the missed dose and return to your normal dosing schedule. Do not double doses. Contact a physician if any of the above side effects are severe or persistent. This concludes the Paliperidone drug card.